Okay, so today we are going to talk about the DIME program. What is the DIME program? How will that benefit you? And what is it all about? How did it start? So here goes. So DIME is, it's not even like dime a dozen. It's like a free program for everyone. So I repeat, it's not even a dime a dozen. It's a free program meant for everyone, and it is basically to prevent, halt, and reverse heart disease through DIME. What is DIME? DIME is DIME. DI is diet, M is meditation, and E is exercise. As a general rule, the diet is whole food, plant based, and mostly it is vegan. If not vegan, then vegetarian. Vegan will give you better and faster results. So you have to consume fruits and vegetables, preferably in the raw form. Some foods may be allowed cooked, like legumes and grains, but to a minimum extent, especially if you want fast results and quick reversal of coronary artery disease. There is a huge list of fruits and vegetables which you can consume. They can be seasonal and regional, and you can see that in our application, the mobile app called Healthy Heart Hub, and also explore the website healthyhearthub.in. So you'll find the list of things to eat. So this is in general, but of course, those people who come to us for guidance, we give them specific guidance because some people might be having liver disease, gallstones, renal failure, renal stones. So the diet will vary a little bit, but on the whole, as a general rule of the thumb, it's like fruits and vegetables, and basically intermittent fasting or prolonged fasting, sometimes even going to juice fasting or water fasting or even dry fasting, depending on how severe the disease is and how fast and effectively the person wants the reversal of coronary artery disease. The next is meditation. This is a special technique created by Healthy Heart Hub only to reverse coronary artery disease. So it is based on visualization, whereby the patient visualizes that the coronary artery blockages are getting less, or the plaques are flying out into the air, into the atmosphere far away, and the coronary arteries are becoming clean. So, through visualization and meditation, and just concentrating on the breathing, they can reverse their blockages, of course, along with the diet. Now, the third component is exercise. These are specific exercises meant to open the heart chakra or the heart center. So, here we tell them to implement anti gravity exercises. Then we have special yoga asanas or postures, yoga postures, which are meant to open the heart chakra or very specially designed to increase or optimize the heart health. Of course, the person can do his routine walking and swimming. That is fine. But we have a specific set of exercises which will help the patient to reverse coronary artery disease faster. So this is DIME program: diet, meditation, exercise. It is supposed to be for anyone on earth, but specially designed for people having coronary artery disease, those who had angioplasty, those who had bypass surgery, those who do not want to do coronary bypass surgery, those who are afraid of intervention or angioplasty. So those with diffuse artery disease, with multiple blockages, with calcium or calcific blocks in the coronary arteries, this program will definitely benefit them. And you can explore more by visiting the website healthyhearthub.in or www.drsureshbhagia.com, or just join the free Dime program by downloading the mobile app Healthy Heart Hub. Please note that diet plays the major part, then the meditation, and then the exercise. So, with this, I leave you to start your session on Dime or implement the Dime system or program. Thank you. So, that means that root cause, मूल कारण ठीक नहीं हुआ है उसका. So we have to become heart attack proof, like उनके biomarkers को सीधा करके, so that they don't get heart attack again. We have to make them solid, leak proof. Now those who have been refused surgery due to high risk, so doctor ने ना बोल दिया. So doctors are saying that oh, you are having kidney failure, liver failure. If you do this surgery, you may die in the ICU. तो ऐसे लोगों को, and native coronary disease जिसमें diffuse disease है, multiple long segments, सब vessels block है, उसमें सर्जन भी कुछ नहीं कर सकता है, और एंजियोग्राफर यानी कार्डियोलॉजिस्ट भी, they will refuse to do anything because risk is high and nothing can be done in such cases. This is a book which I wrote. So this is Amazon bestseller. It is like Bypass the Bypass. Available है 300 rupees में. You can see, if you get time, you can read this book. And heart disease is not the ultimate. सब नहीं मरेंगे. I have seen people with 90% block. They refuse surgery. They are afraid. And they are coming every year for follow. तो हर साल दिखा के जाते हैं. तो ऐसा कुछ नहीं है कि वो डर है, दैट उसको डरा देते हैं कि वो ऐसा होगा, और फैमिली डर जाती है, तो देन दे गो फॉर बाईपास सर्जरी, स्टेंटिंग एक्सेट्रा. सो इट इज नॉट अ नेचुरल थिंग. स्टेंट लगाने के लिए भगवान ने पैदा नहीं किया है, और लाइक बाईपास सर्जरी के लिए. वी शुड लिव अ नेचुरल लाइफ विदाउट एनी tablets and pills and everything. It is the leading cause of death, more than cancer. So over 6 lakhs bypass surgeries are done every year. तो काफी ओवरवर्क्ड है हमारे जैसे डॉक्टर्स के. रोज रोज यानी 20 पेशेंट्स आर कमिंग विथ हार्ट डिजीज एंड दे नीड some treatment intervention. 90% can be done with just medicine and diet, but reverse is happening. 90% को उसमें डाल रहे हैं, टेंटिंग एंजियोप्लास्टी में. So that is fine. अभी ये सिस्टम चल रहा है, तो that is also we have to, maybe it will take time, 10-20 years before people realize that ऐसे हो सकते हैं. And lifetime medications, if you use, then there will be side effects. Liver enzymes are raised and root cause is not cured. So we reverse diabetes, we reverse heart blockages also. And we use the 3-step Dime formula, that is diet, meditation, exercise. लेकिन इसका है, there are 6 pillars of lifestyle medicine. This is based on that. Genetics is now 10%, 90% is lifestyle. It is called epigenetics. So you go over the genes and control your genes. So that is like eat healthy, manage stress, exercise, stop smoking alcohol, don't sleep at midnight, sleep early. So then stress hormones reduce, cortisol will reduce, and slowly you'll see that the things start reversing. Even thyroid, hypothyroidism भी ठीक हो जाता है. In 1 month, 2 months, you can stop thyroid medicine by just changing your diet and sleeping pattern. And this is the official degree from American Board of Lifestyle Medicine. So I am the only one in India, probably, who has got this, because surgeons are not interested in this. They are not aware of lifestyle. They will say कि तेल कम खाओ, शुगर कम खाओ, लेकिन कितना कम खाओ, कितना खाना चाहिए, कौन सा क्या करना चाहिए, they are not aware. They know how to do surgery. So that is good. ऐसे भी लोग. और I have got a lot of experience. If you take a screenshot and just see the names here and see them in Google, so you'll realize that I was lucky to work with these people. They are world-class figures. And many have written books on the subject. And now I am trained in naturopathy, Ayurveda, and even yoga. So along with cardiac surgery, मेरे को इसमें भी interest है. And even the president has given the award for securing highest marks in cardiac surgery. So I have done not 100, 500, it is more than thousands of cardiac surgeries. After that now, I have seen that on the internet, these teenagers, जो 15 साल के है, वो सब आ गए और बोलते we'll reverse this, we'll do that, और 2-3 testimonial ऐसे करके, and then because people are afraid and परेशान है, तो join कर देते, and then they are taking, them for a ride. तो मैंने बोला instead of that, genuine person को आना चाहिए platform पर, and we should help the people who really require this. और इसके लिए मैं तो बोलूंगा कि आई थिंक पीपल शुड गो फॉर 1 week टू हरिद्वार रामदेव बाबा के पास, तो दे विल रियली गेट द इफेक्ट ऑफ रिवर्सल ऑफ डिजीज, कैसे वो खाना खिलाता है और कैसे एक्सरसाइज कराता है, थेरेपीज देता है. तो दैट शुड बी डन एक्चुअली. एंड मेरा भी प्लान उसी के स्टाइल में बेस्ड है, बट माइन इज ऑफलाइन एंड online. Online for people who are away, Delhi, Mumbai, Bangalore. And only thing is cheating होता है because distance है, कभी उनका मूड आ गया तो डाइट फॉलो नहीं करेगा जो मैंने उसको लिख के दिया है स्पेशल. और like exercise, he may say that okay, today is Sunday, so I will not do exercise. तो वो discipline करना पड़ेगा. You have to be accountable, and then definitely you get the results. Because I cannot do exercise for you, or I cannot do the specific diet which I say, like eat coriander and dhania or pudina, mint. So I cannot eat that for you. You have to do once I say or write on the paper. So we are not against medicine. I am a hardcore allopathy doctor. But I integrate this with nature and the elements of nature. And I even now I do surgery, cardiac surgery में अभी भी bypass करता हूँ. अभी 2 दिन के बाद फिर से after Holi we are doing coronary bypass surgery. But now मैं कम करता हूँ. Only those who require heart surgery I will do, not routinely. पहले ज्यादा करता था, but now I realize that सबको जरूरत नहीं होती है. Only some people actually need heart surgery. This is in Vietnam. So I teach people in different countries how to do heart surgery. And this was Hanoi, Vietnam, e-hospital. And you should not ignore symptoms like tiredness or dizziness, irregular heartbeat fast and slow हो जाता है, chest pain, angina, or like which is actually called heart attack by the public, or poor sleep, anxiety, and if you are taking pills for BP, sugar, cholesterol for more than 1 year, then it's a problem. That means the pills are not working or something is wrong. नहीं तो अगर वो pills काम करती तो आप ठीक हो जाते. And this is just a sample of how the heart attack is. Oh, yellow cholesterol आ जाता है and then the blood supply उधर ऊपर नहीं पहुंचता है to the heart. Medicines or pills will not fix your disease or the root cause, but lifestyle will. And so it is time that you take this seriously, those who are having this issue or even their relatives or friends. तो धीरे धीरे डैमेज होता है. डायबिटीज, कोलेस्ट्रॉल, हाई बीपी, because of friction, continuous friction on the tube, the artery. It causes a problem and wear and tear, and then a stroke and brain stroke and paralysis. So we say DIME is diet, meditation, exercise. Small I is for ideology. You change the mindset. कि अभी कुछ भी हो जाए करना है. जैसे I think there was Hrithik Roshan. So Hrithik Roshan, said that अभी बहुत हुआ, अभी मेरे को 6-pack बनाने हैं. So then he did something. He went to the gym every day, diet uska change, and then so ideology, the transformation has to take place. So that takes approximately 2 to 3 months. Then you can continue on your own. And D is whole food plant-based eating. That is very simple. मैं शेयर करूंगा एक sample diet chart which anybody can follow. I'll send it free. I think it is on the website also. मेरे website पर भी है sample diet. So you can try that out. कि कैसे खाने का है, क्या करने का है. Flax seeds, omega-3, almonds, walnuts. Only 2 almonds, 2 walnuts. ज़्यादा खाएंगे तो cholesterol बनेगा. High cholesterol, LDL. 2 खाएंगे तो HDL बनेगा. So very important to control this. ऐसा नहीं कि एक मुट्ठी भर के if you eat nuts so it is healthy. It is not healthy. Only 2 walnuts and 2 almonds are healthy. ज़्यादा खाओगे so there is a problem. You will have a high HDL and landing up in heart attack and this thing. White poison, everybody knows. Sugar, flour, salt, oil, all white poison. I even said no to dairy, meaning like milk, because anyway milk is artificial or cruelty se aata hai. So I know people are brought up on milk since childhood, but there is a problem. So then I introduced them to intermittent fasting. That is maybe 16 hours of fasting, 8 hours eating. Then slowly some days going to once in a week, 20 or even 22 is to 2. 22 hours fasting, 2 hours this, once a week. And जिसको fast healing करना है तो उसको I put them on even coconut water for 1 full day. So 24 घंटे only lemon water or coconut. So it will, heal the body. This is a very good picture of healthy fruits and vegetables. So this has to be followed. Healing hota hai. Lot of sound noise on the internet about prebiotics and probiotics. दही में probiotic है और ऐसे healthy gut bacteria. So this is a list. You can see this. I'll put on a video in the group, so you can go through. अगर miss होगा तो. And probiotics are like dahi and kefir and tempeh and pickles, achar. So and natto. Japan, Korea में ज़्यादा होता है ये सब. and reprogram your thinking that now enough is enough. And अभी बहुत हो गया. Now we have to do something for ourselves. जानबूझ के क्यों अपने आप को हैरान करने का, to spoil the health. And M is for meditation. I teach them meditation actually. If they join the class, तो मैं उनको personally meditation सिखाता हूँ, how to do affirmation and visualization and mind and body healing. And E is for exercise, which is like walking and yoga and anti-gravity exercises. If you go on Google, तो Google के अंदर anti-gravity exercises है. They are very important for lowering blood sugar and even reversing heart disease. So that is a good thing. And I have got now several. अभी लोगों की privacy, I maintain privacy. I don't like to highlight like these digital marketing people कि मैंने इतने सब रिवर्सल कर दिए और उसका फेस दिखाओ and ऐसे. Some I have kept actually with the faces. I asked permission. And then I said, because otherwise people will not believe. Because these teenagers, digital marketers, they are putting these photos and pictures. So I said, I will also put some from different places like Dubai and Gujarat and Bangalore and Delhi, Mumbai, Hyderabad. So I put some YouTube videos. You can just type Dime and Dr. Suresh and वो videos आ जाएंगे on YouTube. And nobody is immune. सबको heart attack होता है. Yeah, celebrities are dying. Even I think the comedian Obi Raju Srivastava, I think Obi मर गए, and then so many people, die young age. Nobody is immune. होता है. It is mainly on lifestyle. Sleeping is very important because if you don't sleep from 10 to 4, which is the healing time, no problem आएगा. I have studied this. Actually, I asked the patients who come to me कि इसका weight 50 किलो है, इसका cholesterol भी 150 है, which is lower than normal, below normal. तो इसको heart attack क्यों हुआ? और उसकी तो मैंने आर्टरी खोल के भी देखी on operation table. Then I saw that this person was sleeping at 12 midnight. तो उधर से वो प्रॉब्लम हुआ. Another person will say कि मेरे पास स्ट्रेस था, घर में डाइवोर्स चल रहा था और लाइक चिल्ड्रन आर हैविंग प्रॉब्लम्स और एग्जाम्स एंड दे फेल्ड, तो उसके लिए हुआ. So I correlate the coronary artery with the history and their lifestyle. कि इसको क्यों ऐसे हुआ, डायबिटीज भी नहीं है फिर भी हार्ट अटैक किधर से हो गया इसको. So I have done a lot of research in this one. Abhi, next is those who are interested. I think we'll give them this custom 3-month plan. But so this is a certificate. When the president awarded this, he lost my certificate. So actually, he told me to wait, and then we could have like 5-6 photos. He was talking to me. So it is good that he lost my certificate. He gave me somebody else's. और रमेश पटेल का दे दिया और मैंने बोला आई एम सुरेश. सो ही सेड वेट, आई विल फाइंड इट एंड देन यू गो फ्रॉम द स्टेज. तो अच्छा हुआ, वो मजा आया था. दिस वाज इन कोचिन एंड दीज आर डिफरेंट सर्जन्स विथ whom आई हैव वर्कड. और अभी तो मैं गुजरात में हूँ. This fellow has written a book. He is earning $1,000 every day. Caldwell Esselstyn, How to Prevent and Reverse Heart Disease. So he is on Zoom with me. I have told him to come to India, but he is 92 years old. तो बोलता है कि अभी नहीं आऊंगा. From Cleveland, Ohio. Very big guy. He is a surgeon and lifestyle medicine expert. Dr. Caldwell Esselstyn. और आजकल lot of things are going on. that is like ECP, or like some they are giving some injections in the pint के तुम्हारा calcium निकल जाएगा. Then we are giving statins, and people are having redo bypass surgery after 5 years, second time. Again, root cause, oh yeah, with this barcode is not working. So I really don't care about this. What I'll do, let me unmute you one by one. मैंने संध्या के साथ वहां पर बात की थी, अभी दूसरे को भी. लेट मी जस्ट बट लेट मी आस्क यू, ask Sandhya husband to unmute. So unmute yourself.
Okay.
हाँ,
Hello.
Go ahead. Yes, बताओ.
Sir, I'm Sandhya's husband, Raman Soni speaking, sir.
हाँ,
First of all, I must appreciate the kind of knowledge that you are sharing with us. That is really superb, and it is really mentally also benefiting us. I really
yes,
am very much grateful to you, sir. That's a wonderful job that you're doing, and my wishes are with you. That likewise,
thank
you
you.
should keep on healing people physically and mentally as well. Sir,
Right.
as far as my case is concerned, in fact, I got the stunting done almost 3 years before.
Okay.
And sir, I say lifestyle also, yeah, I must admit that yes, I was a smoker. I,
हाँ.
in fact, had smoking habits for almost 12 to 15 years of my life.
Now
And then,
smoking? Now?
no, now not smoking. In fact,
Okay.
the day I had a heart attack, just 3 years before I quit smoking. I
Okay.
repeat, I just 3 years before I quit smoking, and then I had a heart attack.
हाँ.
Although my lifestyle also was good, but then I could never figure out that why did it happen. So I'm just under this impression that maybe because I had smoked earlier for almost 15 years and that was heavy smoking, so maybe that was a repercussion that I could actually have after 3 years, and
Yeah,
I got the
yeah,
heart attack.
that is a very positive factor. I mean, like solid factor for heart disease. Yes.
Yes.
So,
So,
so
and
that is
I must, sir, I just need your advice as well, and I'll get back to you as well. Sir, I was a little afraid of, taking allopathic medicines. Although my father was also a doctor, he was more into Ayurveda. Although
okay.
he was BAMS, then he practiced Ayurveda for quite a long time, and I really know the benefits that Ayurveda can actually come up with.
Yeah.
So, I just had the allopathic medicines, whatever the doctor suggested me, including statins and ecosprin, and I don't even remember. I mean, all the
The
medicines. I
routine.
just continued
Huh.
routine medicine for 1 month. But then I had my own Ayurvedic doctor also. He's in Samalkha, Sonipat. So he advised me that there is nothing wrong. You can just leave the allopathic medicines. I can take you to the Ayurveda, and it is quite healing as well. It's just that you need to bring the lifestyle as well. So I just took 1 month of allopathic, and then I switched over to Ayurvedic medicines, including some rust and Arjuna and many basams and all the gears.
Yes. Yes.
So things are right, but then still somewhere, whenever I feel like little uncomfortability, like sometimes I feel that yes,
So
I've started eating something.
nice. So what we can do, we have to assess your blood markers like homocysteine, CRP, then lipoprotein A, and very specific ones. Whether you'll get a second heart attack or not, or whether you have actually
Okay,
done good in this way or not. So we can
okay,
advise you that thing. So I will
that's
write you that list. Maybe ऐसा होगा तो पर्सनली फिर से अपन डिटेल में थोड़ा बात करेंगे. I'll share my
yes, sir.
number. Huh. I'll share my number also. And
Please, sir, please.
meanwhile, let me ask Apeksha um, that if she is there and wants to ask a question. So Apeksha, you are there. I am asking to unmute. और नहीं तो फिर
I think,
प्रिया को. अच्छा, Apeksha is hello.
Sir, I don't want to ask anything.
Fine, fine. Okay, I'll go to Priya and then see uh, what she has in mind. Priya asked to unmute. Yes. हाँ प्रिया, कुछ क्वेश्चन या कुछ है? Anything? You are on. नहीं. Okay, fine. I think she does not also have a question. So, Apeksha, can I ask you what motivated you to join this, or like क्यों join किया था इसको, or like you are a doctor, or
Sir, I'm a yoga teacher and yoga therapist, and
oh
your
good.
ad, like I
I'll
work
connect
on all this.
I'll connect with you because I'm looking for yoga teachers, and you can do online for some people who may join, like
Okay, sure, sir.
yeah.
Because your ad like really attract me, and I wanted to know like what my husband is also a doctor. Uh,
uh,
so but I
allopathy.
work on all this. He has done MD in PSF,
Preventive
and
social medicine.
yes, and he is director in NIOH, National Institute of Occupational Health.
Occupational health. Yes, yes, I know.
Yes.
Yeah, नहीं, that is good.
So,
बहुत ही अच्छा है
but I
PSM.
am interested in the yoga and lifestyle correction. So I am working as a yoga therapist and a yoga teacher. So,
In which place?
whatever you said, whatever you have said, like lifestyle correction, sleep, and all these things really help us a lot. So, like what you others thinks about it, I wanted to know, and what like sometimes
हाँ,
uh, if diabetic people are there, they insist on 2 hour. They should eat every 2 hours. Even I
wrong,
believe in
false.
like intermittent fasting and all that.
हाँ, नहीं नहीं, false, false. वो कम खाएंगे तो अच्छा है because we have to lower their glucose levels and insulin spike. So therefore, not every 2 hours, they should eat every 12 hours or even more. if they can. डीप साइंस है, बहुत ही बड़ा डीप साइंस है. एंड एक्चुअली
Hmm.
ये फ्रॉम जनरेशंस, यानी परंपरा से सदियों से ऐसे बोलते हैं कि नहीं, हर 2-3 घंटे उसको खाना है, 2-3 घंटे खाना है.
हाँ.
बट दैट इज एन इश्यू, दैट इज अ रियल सीरियस प्रॉब्लम. और उसका
So सर
कभी ठीक.
आयुर्वेद में भी ऐसा बोलते हैं ना कि यू शुड गिव रेस्ट टू योर स्टमक, क्योंकि
यस.
पूरा इवन आप चिकन का एक टुकड़ा भी खा लेते हो तो पूरे आपके डाइजेस्टिव ऑर्गन को फिर से काम करना पड़ता है,
अभी
और उसकी
एक
वजह से
आपको क्लू देता हूँ, बहुत सीरियस क्लू एंड टिप देता हूँ. आप अपने पेशेंट्स, अभी सपोज 10 पेशेंट आप देखना डायबिटीज के, कल से 10 दिन में 10 पेशेंट देखना. उनको पूछना कितने लोगों ने फास्टिंग शुगर और ये सब तो सबने कराया है, कोलेस्ट्रॉल, कितने लोगों ने फास्टिंग इंसुलिन लेवल कराया है. सो दे डोंट इवन नो, नाइदर द डॉक्टर नोस. द सीक्रेट ऑफ ट्रीटिंग दिस डायबिटीज इज फास्टिंग इंसुलिन लेवल. तभी इंसुलिन रेजिस्टेंस को तोड़ के और ब्रेक करते हैं. तो फास्टिंग इंसुलिन मुश्किल से 100 में से एक डॉक्टर और एक पेशेंट का होता है. तो दे विल नेवर गेट ट्रीटेड.
हम्म.
वो कंटिन्यूस मेटफॉर्मिन इंसुलिन इंजेक्शन पे चलता रहेगा 20 साल तक. अभी मेरे पेशेंट्स 2 महीने में दे आर ऑफ इंसुलिन, दे आर ऑफ मेटफॉर्मिन एंड ऑल द मेडिसिन. यानी ऑलमोस्ट आई कैन से के मास्टर ही आ गई है. तो 2 महीने में तो डायबिटीज को रिवर्स कर ही देता हूँ मैं, ऐसा है. एंड हाँ,
Yes, sir.
फिर ऑफ कोर्स ही डज नॉट हैव टू ईट समोसा एंड जलेबी आफ्टर 10 days एंड ठीक हो गया तो खा सकता है, बीच में खाएगा, 10 दिन में कुछ नहीं होगा,
And
बिकॉज
that
ही
is
इज
fine, but
ट्रीटेड.
लाइफस्टाइल नहीं होना चाहिए. हाँ.
हाँ, लाइफस्टाइल हैज टू चेंज एंड ही कैन ईट. इट इज नॉट दैट लाइफ टाइम के लिए बैन आ गया, बट ही हैज टू फर्स्ट गिव मी 1 or 2 months ऑफ माई थेरापी. वो फॉलो करना पड़ेगा, तभी वो ठीक हो जाएगा. तो बट इट्स अ डीप साइंस, वेरी साइंटिफिक. एक बुक है बहुत अच्छी, जेसन फंग, डायबिटीज कोड. जेसन इज JSONFUNG. जेसन फंग इज अ किडनी स्पेशलिस्ट इन US. तो उसने भी
Okay.
किया है. मेरे पास तो बहुत सब बुक्स है, बट और मैं इम्प्लीमेंट भी करता हूँ. बट हाँ, डीप साइंस है. सो दैट इज रॉन्ग. 2 hours ईटिंग ना, वो आउटडेटेड है. दैट इज
हम्म.
नॉट टू बी डन. 8 hours जितना एक्चुअली एजिंग को रिवर्स कर सकते हैं. अगर खाना कम खाएंगे ना, तो बाल वाइट में से ब्लैक होने लगते हैं. इफ यू डू फास्टिंग फॉर 24-36 hours, सब ऑर्गन जैसे हीलिंग में चले जाएंगे. एंड डायबिटीज तो बहुत छोटी बात है, बट थायराइड एंड
As you can see, DIME stands for DIME, that is diet, meditation, and exercise, and I is for ideology, the change in the mindset. So, this program called DIME is a very unique and specific tailor made program supervised by doctors and supported by a team of experts, and it is scientific and structured and also spiritual. So do take this time program if you want a guaranteed success in the reversal of your chronic lifestyle diseases like heart blockages, diabetes, hypertension, and high cholesterol and thyroid disorders. So, time again, diet, ideology, mindset, meditation, exercise like yoga, swimming, aerobics, and many other things which are added in this program by the team of experts led by expert doctors ranging from cardiologists and cardiac surgeons and lifestyle medicine experts to physiotherapists and yoga therapists and psychologists to help you reprogram your brain and make sure that you succeed in your aims or goals that you set. So, once again, we request you to join this time program which will look after your heart, and you are in safe hands, and there is hand holding. So only those people who are serious will be able to join, and the others may just watch the recording and then try to do it on their own. So we come to the end of this recording, and good luck to you, and hope you take your life and health seriously and make the best use of it. Good luck